Skyland Trail clients are successful here in part because of our continuum of care. As clients make progress, our system changes. When a client comes in and they need lots of support, our system is there to help give that support. But as clients get better, our system adjusts and gives them more opportunities for independence and for practicing skills in different places. You know, at Skyland Trail, we meet clients where they are, but we don't expect them to stay there. We expect them to grow and change, and our system gives them room to do that. Residential treatment is a unique level of care. It's appropriate for clients who don't need an inpatient hospital setting because there aren't imminent safety issues or acute psychiatric distress, but they need more support than they're going to get seeing an outpatient provider like a psychiatrist or a therapist in the community. The goals of residential treatment are to continue the stabilization that might have already started in an inpatient hospital setting, or to provide a lot more support and oversight than a person is getting at home. So the goals tend to be developing the basic skills for managing distress, stabilizing medication, practicing healthy skills like sleeping habits and eating habits, engaging in therapy in a way that is useful and can start a path to recovery through the continuum of care. One of the things I love about Skyland Trail is that we really appreciate how important small gradual steps are in treatment. For some programs, people have lots of hard stops and they have to make a lot of change in a short period of time. We feel that people who are in residential treatment need lots of small goals during the weeks that they're in treatment so that they can make a lot of progress that's sustainable and realistic. So at South and at Rollins, we have level systems that allow people to gain privileges and have more responsibilities over the course of their treatment so that at the end of their time at Rollins or South, they're ready to move into an independent living situation and to continue their treatment in a successful manner. After a client has met all of their goals at Rollins or South, most of our clients move into our day treatment program. Sometimes clients move back home and they live locally and so they can come here during the day. For other clients, they live in our transitional housing, which are apartments that are close by. For clients coming to our day treatment program, one of the great things is that they don't have to change their counselor and their psychiatrist or their core group, their whole recovery team. Everything stays the same in terms of the treatment that they're experiencing during the weekday, but they're living at home and they're practicing skills in a more independent fashion than they were while they were at Rollins or at South. Whether a client's going to admit to our residential program or directly to day treatment is a decision that's made during the admissions process. Clients who come in directly to day treatment are generally clients who are able to stay safe at home, take their medication, and are really engaged in treatment so that they're getting the most out of treatment without a lot of extra staff support during the evening and weekends. When clients have been successful in their goals for day treatment, our next step is to move them to our Intensive Outpatient Program, or IOP. Clients continue to work with their psychiatrist and their therapist. They continue to work with the same core group generally, but they're here for shorter days, and that gives them more time to practice in their homes and out in the community all the skills that they've been working on. Again, it's an opportunity for people to make gradual change, and so a little less time at Skyland Trail each day and a little more time out in the world, which helps people make the progress that they need to make so that they can move forward to outpatient care and be successful. At Skyland Trail, we have a number of outpatient services for clients who've graduated from our intensive services. We have our primary care clinic, which provides medical care. We have our vocational services program to help people get back to work and back to school. We have our outpatient DBT program, our LEAP program, which is our social and recreational program, and we have independence coaching. A client who's finished any of our intensive services may want to continue one or many of these programs as a part of their transition back to independent life. One of the really exciting programs for graduates of Skyland Trail is our Alumni Program. Usually our Alumni Program meets 3 times a month, and they also do social outings out in the community several times a year. Having all of these different steps across our continuum allows clients to make progress at the pace that's appropriate for them, and to be able to step back if they've moved too quickly and practice some skills to become more stable and sturdy so that they can keep moving forward along our continuum and prepare for independent living.